Hi, my name is James Hargreaves. I'm here to introduce to you this PhD studentship offered through the MRC London Intercollegiate Doctorate Scheme. It's called Improving Intervention Design for Health Equity, Inequality Aversion Parameters and Infectious Diseases in Africa. The two supervisors for the PhD will be myself. I'm a professor in epidemiology and evaluation in the Department of Public Health, Environment and Society in the Faculty of Public Health and Policy. And Tim Powell Jackson, who's in the same faculty. He's professor in health economics and he's from the Department of Global Health and Development. So this PhD is all about health inequalities and how they relate particularly to infectious diseases in Africa. We've recently run a big grant from the Wellcome Trust, which we called Breaking the Inverse Laws. And it talked about how uptake of health interventions are always lower amongst populations that have the greatest need, paradoxically. Also, new health technologies, even those intended to improve health in the most disadvantaged populations, often actually benefit the most advantaged groups first. And part of the problem is that there's an inherent tension between achieving the maximum health impact with a tool and ensuring health equity. There's also a constant force that puts these tools and new technologies and health interventions that we have often in the hands of those who have a bit more advantage in society first, and therefore they can sometimes increase inequalities. And people who make policies, whether that's at country level or at international or even global level, are often acutely aware that they would like to address equity, they would like to address distributional concerns, but they lack the data and the tools to precisely define policies in a way that will make health equity better, even if that comes at the expense of achieving slightly less health impact. So this PhD is centered around the concept of a measure called an inequality aversion parameter. It will collect, analyze and interpret data on these parameters, and then we will encourage the student to think about applying these parameters to infectious disease control programs in African settings. As I've mentioned already, the PhD will benefit from being nested in a really exciting new project. It's funded by a Wellcome Trust Discovery Award, and it will run across the whole life of the PhD. In fact, it runs from 2026 to 2030, and it's called the INDI, or Infectious Disease Equity Consortium. It brings together scientists from epidemiology, social science, economics, to work on a range of case study infections. They include HIV, measles, a human papillomavirus that causes the majority of cervical cancers, and outbreak-prone infections such as cholera. And the overarching aim of the consortium is to address these inverse laws, as we call them. In each case, the case studies have a technology at the center of them, and we're concerned with ensuring that those technologies don't make health inequalities worse. An inequality aversion parameter is a quantitative measure, and it's intended to allow stakeholders of any kind, but including policy and decision makers, to formally go through the process of thinking about how much they would trade off overall health gains for improvements in health equity. The PhD will be heavily centered around strengthening the skills of the student who does it, as well as being a really exciting project to get involved in, and an important mission around improving global health equity. It will include the design of a novel data collection tool. There are tools available out there to collect data on inequality aversion parameters, but those will need to be adapted, and a literature review will want to be conducted to ensure that they're most relevant for the settings that we're going to work in, and particularly take account of some of the particularities of infectious diseases when policymakers are thinking about this. It will, throughout the PhD, you will encounter a range of measures, both from economics, but also from social epidemiology, and become very well versed in calculating, interpreting, and using inequality metrics, including these aversion parameters that I've mentioned already. And as a really novel component of the PhD, we will, working within the partnerships within the INDI consortium, will find a case study to apply the inequality aversion parameters that you will design the data collection for, collect amongst a range of stakeholders, and we'll apply those to a resource allocation case study. We have, I've already mentioned the focus infections for the consortium, and that might be one avenue to explore, or there could be others. What we're looking for is a really enthusiastic student who has a background in one of the more quantitative sciences that underpin the ideas in this PhD. They include epidemiology, health economics, or another discipline. In order to apply these skills, we'll want a solid foundation with the student in mathematics or statistics. You'll need to have excellent analytical reasoning and critical thinking to apply these parameters, and a demonstrated passion for addressing healthcare inequities in low resource settings, and an interest in collecting primary data. The PhD will strengthen all of these skills. It's a novel project and one of the first attempts to apply these health inequality parameters to infectious disease control programs in Africa, and hopefully a really exciting opportunity to do so. You'll have an experienced supervisory team who are really keen on developing your skills in this area, and you'll be also, as I mentioned, embedded within this larger project of partners from a range of African settings. And I'll mention now actually the countries that the INDI Consortium is working in. They are Zimbabwe, Zambia, the Gambia, and Kenya. And then you'll be part of a vibrant research environment and student body at LSHTM. That's all for now. If you've got questions about the PhD, we'd be really happy to help you think it through a little bit more, and can be contacted at either of these email addresses. Thanks a lot.